Most of the time, the PID is an ascending infection, meaning bacteria travel upward from the lower tract. First, the PID or any infection from the lower genital tract, when ascend upwards, it may also cause infection in the uterus and the fallopian tubes and the ovaries, which gives rise to the PID. To understand how it happens, we first need to look at the cause or the etiology. Normally, the body has a brilliant defense system. Like there are certain factors which protect the genital tract from certain infections. These factors include intact hymen, alkaline mucus, and the acidic pH of the vagina and downward movement of the cilia. Cilia are the microscopic hairs which sweeps the germs out. But this defense system can be compromised. In conditions like during menstruation, the protective epithelial barrier sheds. During an abortion or delivery, medical immunity can temporarily be decreased, and microabrasions or postpartum changes leave the doorway wide open for the bacteria to sneak in. So, who are the main intruders? The biggest culprits are the sexually transmitted diseases, especially some bacteria like chlamydia and gonococci. These are incredibly common in sexually active women under the age of 20. And here is a wild medical fact. These bacteria actually piggyback on sperm. They literally hitch a ride on a moving sperm to ascend up into the genital tract. But wait, what if the woman isn't sexually active? The notes shows us a few other ways PID happens. For instance, genital tuberculosis. This can spread through the bloodstream from the lungs to the uterus, and it's a known cause of PID in virgins under the age of 20. Other entry points include an IUD insertion if done under less than sterile conditions, unhygienic deliveries conducted by traditional birth attendants, also known as DAIs, or criminal abortions. Even a minor operative procedures like an HSG or a DNC, dilatation and curettage, can introduce infection into the patient. So, finally, let's talk about how PID presents itself. It gets divided into two main types. One is acute and the other one is chronic. Acute PID is a sudden, sharp, and aggressive form of PID. A classic example in this type of PID is acute salpingitis, which is a severe, painful inflammation of the fallopian tubes. Now, if an acute infection isn't treated properly or fails to resolve, it turns into a chronic PID.